My name is Dr. Joey Kramer, and I am the upper cervical doctor at Hope Chiropractic Center here in Southlake. And we are a upper cervical spine center that really focuses on helping people overcome unresolved chronic illnesses. Over the course of the last month, a uptick in our practice has been focused on trigeminal neuralgia patients. For many of you who don't know, trigeminal neuralgia is called the suicide disease. And it's my understanding that for these patients, it is the worst pain known to man. And it's actually one that is unexplained by most doctors. And it's really interesting to me because most of these patients will describe what is, a pain that feels like fullness in the ear, unresolved ear infections, dental pain. They have this issue that really hasn't ever gotten better. And that's because the trigeminal nerve, which is your fifth cranial nerve, is responsible for innervating your face or controlling the sensation you feel along the forehead, along your face, and along your jawline, right? So it looks something like this. And what's really fascinating about this is that because the doctors don't know the cause, the surgeons don't know the cause, what they do is they give you medication or they cut things out. Now, as you know, God did not design you with a lack of medication or too many parts. And so what we understand and what we know as a upper cervical focused practice is that the cause is not a medical problem, nor is it a surgical problem. It is a brain stem problem. And for many of you, you don't really think about the brain stem, but the brain stem sits at the very base of your skull. And the cranial nerve number 5 is one of the nerves that come off of your brainstem in branches. And what's really amazing about this is that if I bring up my little model here, and this is going to be your C1 and your C2, and I'm going to bring it up here for you. What we understand is that your brainstem will come down to the base of this second vertebrae. And what will end up happening is that that fifth cranial nerve will come off of this bone, or come off of, not the bone, it will come off of your spinal cord, and it will go into the back of your skull, into this area right here that will make up what is the sensation that you have of your trigeminal nerve. Now, when we have an impingement that will happen because of a misalignment of C1 or C2, it will put pressure and interrupt the normal function of the trigeminal nerve, giving you the sensation that you experience and describe to us in practice, right? Stabbing like an ice pick in the face, fullness of ear, teeth sensitivity, tinnitus ringing in my ear, things along those lines that really we haven't found an answer for by pursuing traditional medical, traditional chiropractic, traditional surgery means. So at our practice, what we do is we evaluate down to the millimeter the misalignment that you are experiencing at the level of your upper cervical spine, C1 or C2. And if indeed you do have a misalignment in this area and it is impinging the function or interrupting the normal signal mechanism of your trigeminal nerve, we are able to correct that misalignment, alleviate that pressure, and restore normal sensory function that would give you back the quality of life so that you are no longer a victim of what is known as the most painful disease, the suicide disease of most people in this world. So this is what I have to ask of you, is that if you are in the Dallas-Fort Worth Metroplex and you are suffering from trigeminal neuralgia, you can reach out to us at 972-638-0994. However, if you are outside of this Metroplex, you can always reach out and we will find a trigeminal doctor for you, a upper cervical spine doctor who will indeed help you navigate your trigeminal problems. Now see, this is the amazing thing. Many of you are a bit weary about pursuing upper cervical care. At our practice, we always give a free consultation. It is our job to help you find the answer to why your trigeminal neuralgia has not resolved. And if indeed it is an upper cervical problem, we will be able to help you alleviate this pain, get rid of this debilitating disease, and send you on with your life in a natural and holistic way. If, however, this is not the issue, we will be able to really work with you and direct you down to someone else who can help you solve this problem. Once again, DFW area, Hope Southlake, hopesouthlake.com, 972-638-0994, and we will help you alleviate your trigeminal neuralgia in a natural and holistic way. You all have a blessed day. Dr. Kramer, Hope Upper Cervical Center.